Go bohlokwa ge o sa le ko sekolong gore o tsebe gore o nyaka go tšea career e feng. Ge ke bolela ka sekolong ke bolela o sa le ko high school or secondary, o tetebelele o le motho gore wena o rata eng, ke eng se leng gore ge o ntse o se dira mo sekolong sa go thabisha. For instance, go ka re o bona gore o rata mohlomongwe papadi, o rata netball, o e rata go feta dilo tse ka moka ene ke passion ya gago, take it because ke yona e leng gore e tlisha lethabo mo go wena. And then as you go by o ntse o gola, maybe let's say you have taken a certain career, o tipotšiše gore wena ka mogare ga career e o nyako bona o fihlile mo kae, a kere o nyako bona gore o nyako bona o reachitše eng mo lifeng, o lebeletše yona career e o tla beng o e tšere, a kere. And then se segolo gape se leng gore se bohlokwa ke what we call attitude. Once you have a very positive attitude in everything that you do, you can never be stopped. So have a very good attitude toward not only the career that you want to take, but also towards life. Have a very positive attitude towards life, and that will bring you to where you want to be in the near future. My name is Lebo Masemola, well known as Makgatho, and I'm from a place called Polokwane in Limpopo, Community District. I'm a daughter, I'm a friend, I'm a twin sister, and I'm a colleague. But most of all, I'm a dietitian by profession. When I was in high school, I was actually exposed to science because our school was mainly based on doing the sciences. So, but after I did my matric, I had to upgrade at various star schools because I did not really qualify to be into health sciences, because that was what I was interested in. I was interested in doing health sciences because my mother exposed me to it, as she's a professional nurse. Because with health sciences, the careers are very broad, so I had to do research while I was at star schools. While I was upgrading, I had to do research on exactly what I want to do, which profession I want to take, especially in that health science faculties. So as I was researching, I got very interested in dietetics, and dietitian, because I felt like I could relate. And as I was reading that job description, so I got very, very interested, and yeah, that's how I ended up choosing this career path. I studied BSc in Dietetics at Medunsa, Medical University of South Africa, which is currently known as SMU, that is Sefako Makgatho Health Science University. For one to get into my career, you need to have the following subjects back in matric. You need to do biology, you have to have physical science and mathematics. Those are the main three subjects that needs to be done if you want to take my career. And the main courses that you'll be doing in BSc Dietetics is what we call therapeutic nutrition, what we call community nutrition, and also food service administration. The challenges that I actually had when I was in varsity was, when you are busy doing your course, you will come across modules that are actually quite challenging, and that would actually drag you down, and then you will start feeling like you actually took a wrong career path. But then, as you go on, and then you get to understand your course, you get to understand your module, and it just keeps you going. I am currently working at the government sector. Since I started working, I have been there. I started working in a hospital setting, and in a hospital setting, I was actually working as a community server. Basically, my main duties as a community server, what I was doing was what we call therapeutic nutrition, and I was also doing what we call food service administration. Basically, when we talk about therapy, we're talking about where we would see different patients, mainly, for example, your pediatrics, which is children, and then you will see your surgery. When you talk about surgery, you normally talk about injured people, and then your medical conditions. When you talk about medical conditions, you're talking about your chronic illnesses, for example, your diabetes and your hypertension, and all of that. And also, I worked as a food service administrator. And as a food service administrator, basically what you do is you manage the kitchen at the hospital. You manage the kitchen from ordering the food, what type of food they should order. You also manage the finances, everything to do with the kitchen of the hospital. And then mainly what you also do is you create menus for the hospitals. You create your normal diet, you create your diabetic diet, you create your protein diet, your high protein diet menus, and whatsoever. And right now, currently, I am actually based in a clinic. I work for Makgatho clinics, Makgatho, which is in Limpopo too. I work as a community dietitian. Basically, what I do as a community dietitian, the main things that I actually do is I do what we call nutritional screening, assessment, and intervention. I'm currently working as a community dietitian. I support a couple of clinics around my area where I'm currently staying, which is in Sefako. Basically, what I do as a community dietitian, I do what we call nutritional screening, assessment, and intervention. Based on what I do is I do this screening, assessment, and intervention to different patients. Okay, it can be your peds. When we talk about peds, we talk about children, where you screen children for whether they are growing well. There's what we call a growth monitoring program, where you screen children whether they are growing well, accordingly looking at their growth charts and whatsoever. And then should we identify things like underweight, or maybe the child has an acute malnutrition, that's where you intervene, and maybe if you have to send to the hospital, you do, or even do the intervention at the clinic, and that is giving supplements. And then what I also do again is I do nutritional counseling to different conditions. Giving examples, that will be your diabetes, if someone is diabetic or hypertensive or even HIV positive. So we do nutritional counseling looking at those kind of conditions. And what we also do is we do school health. When you do school health is we visit the children, and we do, as I have explained in pediatrics, we do that. We check the growth monitorings. We do the growth monitoring programs to children at schools. And what we do again is we also run campaigns for nutrition. We run campaigns such as your breastfeeding campaigns, your obesity campaigns. I see myself having my own private practice. In this private practice, I would be what I'll be doing is mainly focusing on this chronic illnesses, because as I work in a community, I have realized that as Blacks, we think that chronic diseases, when I talk about chronic disease, remember I talk about your hypertension, your diabetes, we see them as a death sentence, because we do not have an idea of what brings this, what causes this conditions. So focusing on that, I think I would be helping a lot of Black people to understand these chronic diseases, and actually have a better way of intervening, especially not only people who have those kind of diseases, but also the family members, on how to handle the situation, and actually not think it's a life sentence or witchcraft or what.